So today we're going to be showing how to put on Velcro wraps. Before any procedure, we always want to do our hand hygiene first. So I have some hand sanitizer here. And then we always want to be wearing gloves. So for these Velcro wraps, there are many different brands of Velcro wraps. Today we have two Pharaohs, lower leg pieces, and a foot piece from Sigvaris, but it really doesn't matter. They follow the same principles. The Pharaoh wraps that we have here, this is a classic. So the Velcro is already attached, and this is a trim to fit Pharaoh, where a trim to fit Pharaoh means you can, as the client reduces in swelling, we can cut and make the garment smaller. But that would not be up to you, that would be up to whoever provided the garments to cut them, or the client themselves if they've been given permission. But just showing you why there might be lines here, because it's to cut the garment as it gets smaller. And the Velcro is not attached to the trim to fit because it will have to be cut over and over again, which makes it a little trickier to work with, but they are pretty good. You'll most commonly will see the classic right here. Okay, so the very first thing we're going to do is we're going to put on our stockinette. This is just a protective layer for the skin. Some of these liners do have compression, but they are not a compression garment. Mainly just to protect the skin. So we're going to just put it on, kind of like tights. Try not to pull from the top. Try to inch it up just like you would pantyhose. There's also different sizes of these. This one's a little big for our client here. But pretty much you want to get all the wrinkles out. Okay. This is also the importance of gloves, because you don't want to pick their garments with your fingernails. So we're going to put on our foot piece first. So like I said, there's different brands of this foot piece. They might do up a little differently depending on the brand, but they follow the same principles. Typically there's a hole in the very back. That's where the heel goes. Okay. Okay, make sure the heel's nice and center. And you want to pull with some tension. Do it with the first piece here and pull with some tension. And yeah. So a very important thing with these Velcro wraps, is you could just rest your foot here, is you want to be tightest at the bottom and loosest at the top. So fluid flows upwards towards the nodes that are going to help drain in the groin. So this foot piece has to be quite tight, and then you're going to do a feeling after to make sure it gradually gets looser, like a funnel. Okay? The end of the foot piece should line up just with the metatarsals here, the knuckles of the toes. Good. Now we'll put on the classic Velcro wrap here. So there's a label, it says top. You want to get about 2 inches below her knee, so just about 2 fingers. And I'm just going to do one strap up just to hold it, but then you actually want to be doing it up, bottom up. Put it in the very center, back of her calf. And very important, if there's one thing I want you to remember most, it's that this piece needs to overlap with the ankle piece. If you have a space between here, that can cause wounds because the fluid and edema will push through that little hole. So that needs to overlap, okay? You're gonna do one piece over, about 25% overlap. You're gonna pull with tension, and then the other piece. Okay, make sure it's overlapping. Good. Now we go up the leg. Pull with some tension. Remember, we want tightest at the bottom, loosest at the top. Okay, next piece. At this point, I'm going to undo this part. Make sure you're grabbing the right flap. Pull nice and flat as well. Okay, last two. So these garments are great because they reduce the shearing forces going up and down the leg. When you pull another garment off and you're pulling down and up, that can cause shearing force and cause wounds. So these garments are great because they just Velcro around. They might take a little more time, but they do really great things for our client. You can see I'm not pulling with as much tension as I get higher. But at the same time, you want enough tension that it's not going to slide down. It's a little bit of a Goldilocks, finding the best scenario. Okay. Once the garment's on, do a test. Is it tightest? Okay, it's gradually getting looser. If you feel tight, loose, you have to take it off and do it again because it will cause tourniquets, and that means fluid is not able to flow upwards. We need it to go gradually up. And so that is an example. Try to get the client's foot flexed as you're putting this on, so when she's walking, it won't hurt her. Same principles with this one here, the Ferro wrap, with the trim to fit, follows the exact same principles in donning. To take it off, it's pretty simple. You literally just undo the Velcro. And then a nice thing to do, because these Velcro gets attached to everything, is just tuck each Velcro in on itself. Typically, you're not wearing these to bed, you're only wearing them in the daytime. Doing the Velcro up, just there you go. Sometimes it doesn't stick to that side as well. There you go. Undo the foot. There you go. And pull it off. When you take the garment off, you might see some slight redness on the skin. That's okay, but if you see like dark redness or indents, you know you've gotten too tight with some of the Velcro here, and you might have even left a gap. So looking at how the skin looks after you remove the garment is important, just to make sure it's looking okay. And right now, we're looking pretty good.